Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to unpack and look at and better understand pain and what is meant by pain and what is pain. And before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our videos related to knee replacement surgery, rehab and recovery, preparation, and much more. So I want to particularly look at chronic pain or persistent pain. And this is that pain that is continuing for a prolonged period of time, for a period of time past what would kind of be the normal time limit for the tissues and the structures of your body, of your knee, to heal and to go back to kind of baseline levels. So for someone, you might have chronic or persistent pain prior to surgery from arthritis or other processes that are going on with your knee or your body. Or you have persistent pain after knee replacement surgery, and it's now been months, it's been maybe a year or more than that out from having your knee replacement surgery, and really the healing and the recovery has already occurred, but you're still having this continued pain and discomfort and maybe other symptoms. And so why exactly is that, and what is that? So pain, one way to describe or to define pain is it's a sensory and emotional experience. And it's an experience in relation to or in congruency with the potential or actual tissue damage or injury. And really the key word there is a potential or actual. So you don't necessarily have tissue damage or injury when you have pain. And this is something that is a really big misconception, and it's really important to understand that to help provide some self-efficacy, some reassurance for people who are experiencing chronic pain after surgery or before having a knee replacement. And the idea is that we think pain equals injury, pain equals damage or harm, or that something is wrong. But this isn't the case. Pain is your body's warning signal. It's a warning signal that there's the potential that something bad or some sort of harm or something wrong is going on, but it doesn't mean that necessarily something is. And what happens is, unfortunately, with chronic pain and pain that lasts a long time, that correlation, that matchup between actual harm or actual risk to your body and risk to the tissues and the structures of your body and the pain that you experience, that correlation or that connection really gets kind of mixed up and gets a little funky. And so really there's not a good accurate indication of what is going on in your body or in your knee joint. So when you have pain, it's not a good accurate indication of your knee. And something to give an example of this is people either before surgery or after surgery again, they'll get an x-ray, they'll get an MRI of their knee joint. And there are plenty of individuals who come in with a lot of pain, maybe some other symptoms, stiffness, swelling, and they think that there must be something wrong with my knee. They go ahead and they get that imaging, that x-ray, that MRI, and their prosthetic, the soft tissue, the muscles, the tendons, the ligaments, the bones, everything looks perfectly all right, looks like it's in tip-top shape, and there's not anything absolutely wrong. And yet they still have this pain. On the flip side of that is people who might have very significant issues with their knee. They might have very significant arthritis. They might have very significant breakdown of cartilage in their knee, and yet they might have very little or no pain at all. So there's not a good correlation. There's not a good accuracy between the pain and the symptoms you're experiencing and if that correlates to actual issues or something wrong with your knee or with your body or the structures. And so that's one thing to really keep in mind, and we'll touch back on that later. But that can be really distressing to think that there's nothing wrong, right? There's nothing, so maybe there's something much more serious that's going on, or what is wrong with me, or why is this happening? Well, the thing is that your body is perceiving a threat. When you experience pain, your body perceives a threat. And when your body perceives a threat through evolution and our biology and our physiology, the body does a bunch of different things to help protect us and help protect the structures of your body. So that includes pain, that includes stiffness and tightness, that includes swelling, and many other processes that occur. And your nervous system and your immune system are involved in this, and what happens is your brain and your nervous system actually starts to get predictive about certain threats and certain situations. So for example, before having your knee replacement surgery or early on in your recovery after surgery, whenever you went for a walk or whenever you went up and down stairs, it was a really painful, really difficult experience and really uncomfortable. And now your body and your nervous system has kind of learned that fact. And so now it's kind of gotten too good at sensing and experiencing that pain response. So now anytime you go for a walk, anytime you go upstairs, anytime you do something that initially caused you pain and discomfort for quite a while, now your body is trying to be predictive and trying to protect you and give you those pain responses, give you those that stiffness, and those different things occur. But we know that your body's healed now. You're months out, you're maybe years out from surgery, your body has healed, your knee has healed and recovered and everything for the most part, unless as long as you've ruled out any red flags with your doctor and your healthcare providers, your body is perfectly fine and the knee is perfectly fine. So what do we have to do about that is we have to retrain the brain, we have to retrain the system to be able to tolerate activities and tolerate things and understand that you have a level of self-efficacy, you have a level of empowerment to do these things, and that they're safe and they're okay, and that pain response that you get is incongruent with what is actually going on in your body with the structures and with your knee. And so something to really focus on and to think about is that each person's pain experience is going to be unique, it's going to be personal. There's going to be lots of different factors and complexities involved. There's the emotional component, there's the psychological component, there's things going on with your central nervous system and your immune system, and there's social support and social networks. And so it's really not that correlation to the physiological aspect, but that's just one piece of the puzzle to consider. And so what do? Well, we create a plan, we create goals, and we try to slowly, over time, get back into activities, get back into doing the things that you enjoy, the things that you want to do. And it takes some trial and error. You might have episodes of flare-ups where you need to kind of take 2 steps forward and 3 steps back. But over time, your body retrains itself, your central nervous system retrains itself to be able to tolerate these things without having significant pain and debilitating pain and discomfort. And it's a stepwise process. It's slow, it's progressive, and it takes time to work up to where you want to be with it. And there's going to be some setbacks, there's going to be some flare-ups, just like I said. So understand that when it comes to pain, it's multifactorial, it can be complex, and there's a lot of different factors and things that play a part in it. And one big thing I would say as a take-home message is just because you have pain and discomfort doesn't necessarily mean that there's something wrong. That doesn't mean there's necessarily a damage or a harm that is occurring to your knee or the structures around the knee or the prosthetic or anything like that. It may just be that your body's warning signal, that alarm system, is on overdrive and it's kind of hypersensitive from all the experiences of having knee arthritis and going through a knee replacement surgery and the recovery process. And we need to slowly retrain that system over time. And we have to slowly learn, and with the help of your physical therapist or your other healthcare providers or social supports, to empower yourself, to have a feeling of confidence and comfort and reassurance that you are able to do these things and you're able to work through the pain a little bit to an extent to slowly get back to doing the activities and doing the things that you want to do, and that your prosthetic and your body and your structures of your body, the bone and the soft tissue, are resilient and it can tolerate those stresses and those things, obviously to a point. Obviously I don't want you doing plyometrics or cutting and twisting and all certain things like that, but the normal daily activities, your body can absolutely tolerate all of those without issue. And it's just a matter of kind of retraining the system and retraining the body and having that reassurance and confidence that you can do those things and the body can tolerate those things. So I hope I didn't get on too much of a tangent. I hope this provided some useful insight and information for you. I'd love to hear your questions, your comments, your personal stories below in the comments, so please be sure to share. Please be sure to hit that like button, as that helps spread this video and get it out to other viewers who may benefit. And as always, again, please be sure to hit that subscribe button if you don't already subscribe, so you can catch all of our videos related to knee replacement surgery, rehab, recovery, frequently asked questions, and much more. Thank you very much for watching.